Hey, well, do you know what are these? Yeah, these are the drumsticks. You know, you play drums with them? Nah, bro, these are not the drumsticks. These are the radius and the ulna, and they are the bones of the upper limb. Well, in fact, all the bones that you see here, they are the bones of the upper limb, and you guessed it right, this video is about the upper limb. Do you know how many bones do we have in the upper limb? Well, we have 64 bones. In case you didn't know, now you know. And each side, it comprises of 32 bones. So the upper limb, it is divided into 4 parts. We have the shoulder girdle, we have the arm or the brachium, then we have forearm or antebrachium, and then we have the hand or manus in Latin. So I'll show you the bones. You know, as I said, the first part is the shoulder girdle, and the shoulder girdle, it comprises of scapula and the clavicle. I will describe them in a minute. And then we have the arm or the brachium. This is the humerus that makes your arm. So, you know, you place it, well, you do not place it, but it's naturally placed here. And then we have the forearm. The forearm, it contains the radius and the ulna, you know, so like this. We have the forearm, and then of course it's not hard to guess what is this. The tiny little hand, just like this one. So without wasting more time, let's begin with the clavicle. So this is the clavicle, and this is the left clavicle. So first of all, I'll tell you how to identify which clavicle is it, whether it's the right clavicle or whether it's the left clavicle. The clavicle that you see right here on the table, this is the left clavicle. Do you know how? Well, let's find out. So whenever you see the clavicle, first of all, this is the shaft of the clavicle or the body of the clavicle. All right, and then there are 2 ends. We have the medial end, and then we have the lateral end. The medial and the lateral end. So well, let's find out which end is the medial and which end is the lateral. I'll tell you how I personally find out which side the clavicle belongs to. Well, you know, I always use the shaft of the clavicle to help me to determine the side of the clavicle. So as in this case, you see this is the shaft. This is the shaft right here. And every time, well, it's because it's a fact that medial 2/3 of the shaft is always convex. So the major portion of the clavicle has to be convex anteriorly. I repeat, the major portion of the clavicle has to be convex anteriorly. So if we divide the shaft, if we divide the shaft not equally, you will see that the major portion of the clavicle, it is convex. I'm sure you can see that clearly in the video that the major part, that is the medial 2/3 of the clavicle, is the convex part. Well, you know, if it's still not clear, I will repeat it again. The clavicle, it always has to be convex in the major 2/3. So you see here, the major part is convex here. If I look at it anteriorly, it always has to be convex. So the larger portion is convex and the smaller portion is concave. Once again, the larger portion is convex and the smaller portion is concave. So this means that this is the anterior side of the clavicle. So this is the first step to find the side of the clavicle, that you determine which is the anterior side and which is the posterior side. I'll show you the posterior side as well. Now, if it was like this, all right, if it was like this, you can clearly see that the major part is concave. That means this is the posterior side, but we have to look at it at the anterior side. So now this is the correct procedure to look at the clavicle. So now we know that this is the medial 2/3 of the clavicle, whereas this is the lateral 1/3 of the clavicle, because the medial 2/3, that is the major portion of the clavicle, is convex, whereas the lateral 1/3 and the minor portion of the clavicle is concave anteriorly. So this is the rule for the anterior aspect of the clavicle. So this is how you determine, or this is how I personally determine the side of the clavicle. Now, as you know that this is the medial part and this is the lateral part, therefore it's easy to say that this is the medial end of the clavicle and this would be the lateral end of the clavicle. So as the lateral end of the clavicle is on the right side, this means that the clavicle is left clavicle. Well, you know, if it's confusing for you, I'll repeat it again. Well, you know, as a medical student or as a doctor, we know that what's on the right is actually left and what's on the left is actually right. I know that's a bit confusing, but that's how it is. So if the lateral end is on the right side, I repeat again, if the lateral end is on the right side, that means the person, he or she personally has it on the left side. So that's how I determine that this is actually the left clavicle. So let's move on to the features of the clavicle. As I mentioned before, the clavicle has a shaft. This is the shaft of the clavicle. And this is the medial end. And this is the lateral end of the clavicle. So first, let's talk about the shaft of the clavicle. You know, the shaft, it can be divided into the lateral 1/3 and the medial 2/3, as I described earlier. And this time I'll go on with the lateral 1/3 of the shaft first. So the lateral 1/3 of the shaft, this is the lateral 1/3 of the shaft. You know, as you can see, it is flat as you compare, if you compare it to the medial end. The medial end, it is not going flat downwards, whereas the lateral end, it goes flat as we go down. You see, this is flat. It has two borders. It has the anterior border, it has the posterior border, and as you can clearly see that the anterior border is concave, whereas the posterior border is convex. And this part of the bone, it has two surfaces, the superior surface and the inferior surface. Well, as you can see, the superior surface right now, and superior surface is subcutaneous, whereas when you move on to the inferior surface, this is the inferior surface, and as you can see, there is a tubercle right here. You see, this is a slight elevation. There is a slight elevation on the inferior aspect of the lateral side. This is the conoid tubercle, and I will describe the attachments after I describe all the features of the shaft as well as the medial end and the lateral end. So the attachments will be later in the video. So this is the conoid tubercle, and also you can see there is a ridge right next to it. There is a ridge, and it is known as the trapezoid ridge. This is the trapezoid ridge on the inferior surface of the lateral aspect of the clavicle. And now we move on to the medial 2/3 of the clavicle, that is convex anteriorly and it is concave posteriorly. And as you see at the medial end, you know, right here, the surface is quite rough, and on the inferior surface there is a slight groove. There is a rough oval impression at the medial end. Well, if you palpate, you can feel it right here, and at the lateral half of the surface there is a subclavian groove. The subclavian groove is right here, whereas the oval impression that I was talking about is here. You can feel it when you palpate, and there is a small foramen at the end of the subclavian groove. I'm not sure if you can see it in the video, but I'll try to make it clear. You know, there is a small foramen right here. I'm not sure if it's visible. Maybe you can see it on the bone that you practice, and it's right here. I mean, I can see it, but it's hard to show you. But you can, when you practice it on the bone that you receive from your university, you can clearly see it right there. And that is the nutrient foramen that lies at the end of the groove. So we are back to the anterior aspect of the clavicle, and we're looking at it superiorly. Now let's move on to the lateral and the medial ends. So this is the lateral end, this is the medial end. The lateral end, It is also known as the acromial end. It's known as the acromial end, and it is flat from above and as we move downwards. In the lateral end, once again, I'll repeat, it's known as the acromial end, because this end, the acromial end, it attaches to the acromion process of the scapula. It attaches to the acromion process of the scapula. I'll show it to you. So this is the skeleton, and this was the left clavicle. You know, this is what I was telling you earlier. So as you look here, for me, it's on the right. For me, I can see that this is the left side, this is the right side, but this is how I see it. And this is how you see it right now. But actually, this is the left clavicle. I hope you can understand. That's quite easy. This is the left clavicle, and this is the clavicle that we were talking about a few minutes ago. And this is the lateral end of the clavicle. And it is also known as the acromion end because it attaches to the acromion process of the scapula. So right here, this is the scapula, this is the clavicle, and it attaches to the acromion process of the scapula. So this was the acromion end, right? And the joint that we just saw on the skeleton, that was the acromioclavicular joint. Now we are moving on to the medial end. The medial end is also known as the sternal end, and this is quadrangular in shape. As you can see, the medial end, it is quadrangular in shape. This is the medial end. The medial or the sternal end. This is the medial end, or you can also call it as the sternal end. This articulates with the clavicular notch of the manubrium. So the manubrium is a part of the sternum, and this end, the medial end, it attaches at the clavicular notch of the manubrium of the sternum, and there they form the sternoclavicular joint. I'll show you the sternoclavicular joint as well. So once again, we are back at the left clavicle. This was the left clavicle, and right here, this is the medial aspect or the sternal end. You know, this is why we call it the sternal end, because it is attaching to the sternum. This is the sternum, and this is the clavicle, and this is the manubrium of the sternum. This is the manubrium of the sternum, and this is the clavicular notch that articulates with the medial end of the clavicle. So they form the sternoclavicular joint right here. Also, as you can see, you know, the medial end, it also articulates with the first costal cartilage. This is the first rib that is coming beneath or under the clavicle, and right here is the first costal cartilage that is attaching to the inferior aspect of the medial end or the sternal end. And now let's talk about the attachments of the clavicle. So this is, as we know, the lateral end of the clavicle. It gives attachment to the joint capsule, and it helps in the formation of the acromioclavicular joint. Then we move on to the medial end. This is the medial end. This is the medial end, and it attaches to the sternum. It provides attachment to the fibrous capsule of the sternoclavicular joint, and it provides the attachment to the articular disc posteriorly or posterior-superiorly, and then the interclavicular ligament. The interclavicular ligament, it attaches superiorly on the medial end of the clavicle. So this was the medial end, this was the lateral end, and now we move on to the shaft, to the attachments of the shaft. This is the lateral end of the shaft, whereas this is the medial end of the shaft. The medial is the major portion, and it gives convex shape. So the medial portion is 2/3 of the shaft, whereas the lateral portion is concave right here. So let's talk about the lateral portion of the shaft. The lateral 1/3 of the shaft, on its anterior border, you know, this is the anterior border of the shaft, it provides origin to the deltoid muscle. It gives attachment to the deltoid muscle, whereas posteriorly the border, it provides insertion to the trapezius muscle. So anteriorly we have deltoid, posteriorly we have trapezius on the lateral 1/3 of the shaft. Also, if you look here, there on the inferior aspect, you see this tubercle as I described before. If you remember the name, mention it in the comments below. This is the tubercle that I mentioned earlier, but of course I'll repeat again, this is the conoid tubercle. This is the conoid tubercle, and this is the trapezoid ridge. And both of these parts, the conoid tubercle as well as the trapezoid ridge, it give attachment to the conoid and trapezoid parts of the coracoclavicular ligament. So we have coracoclavicular ligament that is attached to the conoid tubercle as well as the trapezius ridge, the trapezoid ridge. Now let's talk about the medial 2/3 of the shaft. Now we're moving on to the medial 2/3 of the shaft. The anterior surface of the medial portion, it provides attachment to the pectoralis major muscle. You must be familiar with the sternocleidomastoid muscle, and this is the part where it attaches to. That is the half of the medial end of the superior aspect of the shaft. So superiorly, it provides attachment to the sternocleidomastoid muscle. Whereas the oval impression on the inferior surface, as we discussed about the oval impression, it gives attachment to the costoclavicular ligament. And whereas the subclavian groove that I was talking about, here is the subclavian groove, it gives insertion to the subclavius muscle. So this is the groove, and whereas if we talk about the margins of the groove, they provide attachment to the clavipectoral fascia. Now if we talk about the posterior surface close to the medial end, it gives origin to the sternohyoid muscle. I'll repeat again, the posterior surface close to the medial end. This is the close to the medial end, and it gives origin to the sternohyoid muscle, and also the subclavian vessels and the cords of the brachial plexus. I'll show it to you on the skeleton. This is the inferior aspect of the clavicle, whereas this is the first rib. So between these surfaces, that is where the cords of the brachial plexus, they pass towards the axilla. Here is the axilla. Axilla is the armpit, and that is how they travel between the first rib and the inferior aspect of the clavicle. So that was all about the clavicle. And well, there's one more thing that I forgot to mention. There is a disease when there is absence of clavicle in the child, or the clavicle, it does not develop perfectly. So this is a congenital disease, and it is known as the cleido-cranial dysostosis. Also, don't forget to subscribe the channel and turn on your post notifications so that you don't miss out on the later upcoming videos. Have a good day.